The emergency room was already alive with urgency that morning. The sharp beeping of monitors blended with hurried footsteps and low, focused voices. Bright white lights reflected off clean surfaces, creating an atmosphere that was both sterile and tense. Every second seemed to matter a lot in here. The doors suddenly opened, and a young woman was rushed in, supported by her mother. Her breathing was labored, short, rapid, and strained. She clutched into her chest, as if trying to force air into her lungs. Miss Manda, a 19 years old university student, struggled to speak. Miss Manda, a 19 years old university student, struggled to speak between breaths. Her face showed clear distress, her lips slightly pale. She instinctively leaned forward, trying to help her breathe better. She rests her hands on her knees, assuming the classic tripod position to help her breathe. Nurses tried to get her vital signs checked immediately. On the other side, her mother, visibly worried, approached the front desk.
Please help her. What is her name and how long has she been experiencing this? Her name is Manda. It started this morning, but she was coughing all night. Thank you. And wait.
Meanwhile, in the emergency room, the nurses are trying to get her vital signs.
Respiratory rate 30 breath per minutes, pulse is 110, and oxygen respirasi and 89% on room air.
That's wow. We need to act quickly to support her breathing. She's showing sign of respiratory muscle fatigue. We need to reduce the effort of breathing.
Miss Manda, we're going to help you get more comfortable, okay? Trying to stay calm.
Yes, nurse. I'm trying. Let's bring her into semicollar position.
Does this feel a little better?
A little.
Finally, the mother get inside the room to check on her daughter. This is the case of Miss R. A 19 years old female university student was brought to the emergency department with complaints of shortness of breath, chest tightness, and wheezing that started early in the morning. She reported that the symptoms worsened after cleaning her boarding room, which was dusty. She also experienced persistent coughing, especially at night. Miss R has a history of bronchial asthma since childhood. She uses a short-acting bronchodilator inhaler as needed, but admitted that she sometimes forgets to carry it with her. She has no other chronic illnesses. Her mother also has a history of asthma. Upon assessment, the patient appeared anxious and was sitting in the tripod position to ease her breathing. Vital signs were blood pressure 120 per 80 millimeter, pulse rate 110 beats per minute, respiratory rate 30 breaths per minute, temperature 36.7 Celsius, and oxygen saturation 89% on room air. Audible wheezing was heard during expiration, and the use of accessory muscle was observed. Peak expiratory flow rate, or PEFR, was significantly below her personal best. The nurses are now trying to get her ventilation support.
Will this help her breathe better?
Yes, ma'am, and this will increase her oxygen levels while we manage the underlying cause.
Miss Manda's oxygen saturation is 91% now. Although still below normal, the improvement indicated that the intervention was effective.
Oxygen saturation is slowly improving, 91% now.
Miss Manda, try to keep your airway open. Don't bend too forward now. Let the oxygen flow properly.
Miss Manda, listen to me. Try to inhale slowly through your nose and exhale gently through your mouth. Like this. So
To
in
calm her down,
and out.
the ER nurse initiated breathing relaxation techniques, which is quickly followed by Miss Manda. Meanwhile, Nurse Nisa prepared for collaborative management.
We need a bronchodilator nebulizer prepared.
and get the doctor's orders. Excuse me, doctor.
Yes.
Doctor, we have a 19 years old female with a history of bronchial asthma. She presenting with severe sleep, breathing, and respiratory rate 30, pulse 110, and oxygen respiratory 89% on room air. She currently on oxygen support.
Alright, prefer nebulized bronchodilator salbutamol administer immediately.
Yes, doctor, I prepare it right away.
Do you have the prescription?
Yes, here it is.
Alright, give me a moment. Is this salbutamol Nebule? Do you need anything else?
Let's answer now. It's urgent.
Understand? Here you go.
Thank you.
You're welcome.
Within moments, the nebulizer was ready. Nurse Nabila checked on the nebulizer to see if it's working properly. It seems to be working just fine, so she turns to explain the medicine to Miss Manda.
This medication will help open your airways. Just breathe normal.
Okay, nurse.
Relax, you look better.
Yes, ma'am. She's responding well to the treatment. Miss Manda, keep maintaining this breathing pattern. You're doing great.
Thank you, nurse.
Ma'am, please stay with your daughter and continue to observe her breathing.
Yes, of course. Thank you so much.
You're welcome, ma'am.
It had been 1 day since Miss Manda was admitted. Her condition had significantly improved. She was sitting comfortably on the bed, accompanied by her mother. Outside the room, the nurses are preparing for a focused intervention, not just on physical recovery, but also on long-term health management. Then, the nurses enter the room with calming and gentle smiles.
Assalamualaikum Miss Manda. Good morning.
Waalaikumsalam. Good morning.
My name is Miss Manda, and this is my colleague, Miss Annisa. Can I see your bracelet?
Your name is Manda,
Yeah.
and your address is in Gorontalo?
Yeah.
Okay, thank you.
Miss Manda, we're going to do effective health management. It's going to be done in under 10 to 15 minutes. Are you okay with that? Yes, nurse.
How are you feeling now, Miss Manda?
I feel much better. My breathing is normal again.
Yes, he looks much better today. Thank you for your care.
We're glad to hear that, ma'am. Today, we'd like to talk a little about how to manage your asthma moving forward so this doesn't happen again.
Okay, nurse. Miss Manda, can you tell us what you think would cause your asthma yesterday? Maybe because of the dust. I was cleaning my room. That's right. Dust is a common trigger. Now, do you usually take precautions before you clean? Not really. I just clean it normally.
Alright, and about your inhaler, how often do you carry it with you?
Sometimes I forget to bring it.
Thank you for being honest, that's important.
Miss Nanda, managing asthma isn't just about treating you in hospital. It also involves your daily responsibility to prevent the attacks.
Carrying your inhaler is very important. If you don't have it during an attack, it can become dangerous like that happened yesterday.
Yes, nurse, I understand. I did not think it would be that serious.
That's okay, what matters is that you understand it now.
Now, let's think together. What can you do to make sure you don't forget your inhaler? Maybe I can put it in my bag all the time. That's a great idea. You can also set a reminder on your phone and put it in a place that you can check before you leave. Yes, I can do that. Okay. Ma'am, it's also helpful if you remind her in the beginning.
Yes, I will. I want her to be more careful.
Okay.
Ultimately, Miss Manda needs to take responsibility for her own health. But family support is very important.
I'll try to be more responsible.
And that's already a very good step.
So, Miss Manda, today we've talked about recognizing triggers, carrying your inhaler, and taking responsibility for your own health.
Do you have any question or anything you'd like to share?
No, thanks, nurse. Miss Manda and ma'am, me and Nurse Nisa have to go. So if you notice any symptoms or if you want to call us, please reach out to us in nursing station. Okay, nurse. Okay.
Take care, Miss Manda. We'll check on you again later.
Thanks for your care, nurse.
Alright, goodbye. Assalamualaikum.
provided went beyond immediate clinical intervention. It extended into education, guidance, and continuous support, ensuring that the patient was not only treated but also prepared. Prepared to recognize triggers, to adhere to treatment, and to take an active role in maintaining her own well-being. But beyond that single recovery, the rhythm of care never stopped. Back in the emergency unit, monitors continued to beep. Footsteps moved with purpose, and new patients arrived carrying their own struggles. For the nurses, this was only one of many cases, one story among countless of others. Yet, within each case lies a lesson, a responsibility, and an opportunity to make a difference. Because nursing is not only about restoring breath in moments of crisis, but also sustaining health beyond it, through knowledge, support, and continuity of care. At the end of this video, we will discuss all about asthma. So, what is asthma? Asthma is a lung condition which affects all ages, but usually starts in childhood. Asthma causes minor to significant breathing difficulties depending on the patient. It is caused by the airways narrowing. There is currently no cure, but symptoms can be managed with the right treatment. These are the symptoms of asthma. General symptoms include wheezing and breathlessness, excessive coughing, and lastly, tightening in the chest. While symptoms of an asthma attack include severe wheezing and breathlessness, fast breathing, fast heartbeat, drowsiness, and blue lips. These are the causes of asthma. Well, the exact cause of asthma is still unknown, but research suggests that the following factors could increase the chance of getting asthma. The factors are genetics, pollution, having an allergy-related condition, and lastly, childhood exposure to tobacco smoke. To diagnose a patient with asthma, a general doctor is usually able to diagnose asthma or may refer a patient to a specialist. The following tests can be carried out to diagnose asthma, including 1. Spirometry, blowing into a machine to measure how fast the patient can breathe out and the air capacity of the lungs. 2. Peak flow test, regularly blowing into a device to measure how fast the patient can breathe out. 3. Phenotest, breathing into a machine to measure the level of nitric oxide, indicating lung inflammation. These are the treatment of asthma. First, inhalers. Inhalers are preventer, reliever, or combination of inhalers. 2. Tablets like LTRIs, theophylline, and steroids. 3. Injections, which is prescribed by a specialist. 4. Complementary therapies like breathing exercises and relaxation techniques. To live with asthma, someone has to be consistent with their treatment, have regular checkups,
have the flu vaccine, and have to keep a healthy lifestyle.
Bening. Kedua. Oke, bisa. Oke, action. Oke. Please.
Yes, I feel a little better.
Satu, satu, dua, tiga. Tiga. Tidak bagus ternyata. Oke.
Assalamualaikum Miss Manda.
How to manage your moving asthma forward so this doesn't happen again.
Oke.
For your care.
Ulang.
Take care, Miss Manda. We'll check on you again later.
Alright, goodbye. Alright, goodbye. Assalamualaikum. Listen to me. Try to inhale slowly through your nose and exhale gentle.
Oke, lanjut. Lanjut, satu, dua.
Yes. A better. Respiratory. Tuh, dia langsung habis dari napas ini.
Lanjut.
Ini baliknya. Respiratory rate is 30 breath per minute. Pulse is 110 and oxygen respiration.
Showing sign of respiratory muscle fatigue, we need to reduce. We need to. She's showing sign of respiratory muscle fatigue.
Suster next. Kok tidak mau mati nih, Sa? Oke. Udah. Oke. Tunggu. Oke.
Miss Nanda, managing asthma, you think cause your asthma attack is a day?
Oke.
Maybe because. Yes, here it is.
Oh, kayaknya ada
Kalau cepat, pelan-pelan dong.
satu, dua.
Yes, here it is.
Oke. Ulang. Satu, dua, tiga.
Yes, he looks much better today. Thank